Basic anatomy, anatomical classification. The study of basic anatomy encompasses a variety of approaches to understanding the human body. Macroscopic anatomy involves observing body structures that can be seen with the naked eye. Examples include dissection of a cadaver to study organs such as the liver, heart, and brain. Study of organ systems such as the skeleton and musculoskeletal system. Microscopic anatomy, using a microscope to study tissues and cells, including epithelial tissues, e.g., skin and lining of internal organs. The microscopic structure of blood vessels, such as capillaries. Functional anatomy focuses on the relationship of structure to function. For example, the shape of the alveoli in the lungs allows for efficient diffusion of oxygen. Clinical anatomy, the application of anatomy to medical practice, such as recognizing the location of blood vessels when drawing blood or administering an IV. Anatomical classification is a way of organizing and categorizing the various aspects of the human body that are analyzed in the study of anatomy. This classification makes it easier to understand and map the various structures of the body in an organized way. There are several ways to classify anatomy. Depending on the focus or approach used in studying it, here is a detailed classification of anatomy, 1 by 1. 1. Anatomical classification based on body parts. Human anatomy can be divided based on body parts, both structurally, such as bones, muscles, organs, and functionally, such as body systems. A. Gross anatomy. Description. This is a part of anatomy that studies body structures that can be seen with the naked eye, without the aid of tools such as microscopes. This includes the main organs and body systems that can be understood through palpation, visual inspection, and dissection. Example: large body structures such as the brain, heart, kidneys, liver, lungs, and digestive system. B. Microscopic anatomy. Description. This is a branch of anatomy that studies body structures that can only be seen using tools such as microscopes. Microscopic anatomy focuses on cells and tissues. Example: epithelial tissue, muscle tissue, nervous tissue, and other cellular structures that form the human body. 2. Anatomical classification based on function and body system. In this classification, anatomy is categorized based on the function and body system that relate to each other to maintain body homeostasis. A. Systemic anatomy. Description. Systemic anatomy classification focuses on the study of organs and structures of the body that are grouped together in a particular system. Each body system functions to maintain the body's survival. Examples of systems in systemic anatomy: musculoskeletal system examines the bones, muscles, joints, and ligaments that allow the body to move. Cardiovascular system. Examines the heart and blood vessels and how blood circulates throughout the body. Digestive system. Examines the organs involved in digesting food, including the mouth, stomach, intestines, liver, and pancreas. Respiratory system. Examines organs such as the nose, trachea, bronchi, lungs, and how the process of breathing occurs. B. Regional anatomy. Description. This classification focuses on the study of body parts based on specific regions or areas of the body, without regard to body systems. All structures within that region of the body are studied. Examples: head and neck includes the brain, eyes, ears, teeth, tongue, and other supporting structures. Thorax, chest, contains organs such as the heart, lungs, and major blood vessels. Abdomen examines digestive organs such as the stomach, small intestine, large intestine, liver, and kidneys. C. Comparative anatomy. Description. Comparing human anatomy with other species to see similarities and differences in body structure. This is often used to study evolution and adaptation. Example: comparison of human anatomy with animal anatomy, such as comparison of bone structure or internal organs between humans and primates or other mammals. 3. Classification of anatomy based on study approach. Anatomy can also be classified based on the approach used to study it, namely the structural or functional approach. A. Descriptive anatomy. Description is an approach that describes the structure of the body in detail, including the size, shape, location, relationship between body parts, and the function of each structure. Example: in-depth description of the shape of bones, types of muscles, blood vessel structure, or the position of organs in the body. B. Functional anatomy. Description emphasizes how each body structure works and functions in the context of the larger body system. Example: learning how the heart pumps blood, how the respiratory system supplies oxygen to the body, or how muscles work to produce movement. 4. Classification of anatomy based on teaching and teaching process. In the context of teaching, anatomy can be divided into various fields to help students or medical professionals learn it in more depth. A. Clinical anatomy. Description. Clinical anatomy focuses on the application of anatomical knowledge to diagnosis, treatment, and surgery. This is an approach that connects basic anatomy to medical practice. Example: the application of anatomical knowledge to understand bodily injuries, such as broken bones, anatomical abnormalities, such as tumors or organ swelling, and for surgical procedures. B. Surgical anatomy. Description focuses on the body structures that are directly relevant to surgical procedures. It includes a thorough understanding of the location, relationships, and depth of body structures to ensure surgery is performed safely. Example: understanding the anatomy of internal organs to guide surgeons in avoiding damage to blood vessels or vital organs during procedures. C. Developmental anatomy, embryology, description. Studying the development of body structures from the embryonic stage to adulthood. This includes the formation and differentiation of tissues and organs. Example: study of the development of the nervous system, musculoskeletal system, or other body organs from the early embryonic stage. 5. Anatomical classification based on tools and technology. This classification refers to the use of certain technologies or methods in studying anatomy. A. Anatomy by dissection. Description. This is the most traditional method of studying anatomy, where the body or body parts, usually cadavers, are cut open to analyze their internal structures. Example: learning basic anatomy in the classroom through dissection of the human or animal body to visualize the body's organs and systems. B. Anatomy with medical imaging. Description. Modern medical imaging such as CT scans, MRIs, ultrasounds, USGs, and X-rays provide images of the structures of the human body without the need for physical dissection. Examples: using imaging to examine the structure of bones, muscles, and internal organs, as well as to plan surgery or diagnose disease. 6. Anatomical classification based on location approach. In this approach, anatomy is classified based on specific body areas, and involves the study of specific body parts or organs. A. Head and neck anatomy. Description. Studying the structures found in the head and neck, including important organs such as the brain, eyes, ears, throat, and thyroid gland. Example: anatomy of the brain, cranial nerve system, and the structure of blood vessels and muscles around the neck. B. Thoracic anatomy, chest. Description. Focuses on the structures found in the chest, including the heart, lungs, large blood vessels, and muscles that play a role in breathing. Example: the structure and function of the heart and lungs in blood circulation and respiration. C. Abdominal anatomy. Description. Studying the organs in the abdominal cavity, such as the stomach, intestines, liver, kidneys, pancreas, and the blood vessels that supply these organs. Example: understand the structure and function of the digestive organs and the relationship between the digestive organs. Conclusion. Anatomical classification provides a clear structure for studying the human body. This division facilitates in-depth understanding of both body structure and function. From macroscopic to microscopic anatomy, and from clinical anatomy to comparative anatomy. Each classification plays an important role in exploring various aspects of the human body for medical purposes, teaching, research, and the development of medical technology.